Welcome everybody to the first episode of Unapologetically Katie. And of course I am Katie. I've got my two little fur babies in the back there, Mabel and Betty. They're always by my side. And I thought about what the first episode would be. And I thought that I'd have to look and it'd all have to be set up a certain way. But at the end of the day, I'm not overthinking it. This is me. This is who I am. And I will show up as me. So, yeah, I'm not overthinking it. This is just going to be a platform for me to speak my truth even more. You're only allowed a certain amount of time when you're doing reels and things like that on Instagram, which tends to be like the main platform for me. But then I have to be really careful with what I say, and they have like bots and stuff on there. And I don't know if YouTube, I don't know if they have bots or they're searching for certain things that you're saying or whatever. I'm not sure. It's probably something that I need to look into. I might have to use code words that will mean certain things just so I can speak about it maybe. I don't know. But this is going to be the first one, and it'll be interesting to see how it develops over time, for sure, or where it will go. I don't know, if I'm honest. But I know that this year, 2025, I'm not overthinking about everything having to be perfect or me having to have the full shebang and the full setup. It is what it is. I've got my phone, I've got a light on the phone, I've got my two dogs in the background. I don't have a studio. I don't have a microphone. It's just my phone and my voice. And that's it. So yeah. If you've followed me on Instagram, I'm known as the Hormone Healer. If you don't follow me on Instagram, make sure you give me a follow. Make sure you subscribe to my channel as well. Show your support, please. That would mean the world for me, especially as a woman. That'd be great to actually be pushed into the big manly wide world, wouldn't it? That'd be amazing. So the more that you support me, the better it is for all of us. I actually posted something on my Instagram story today, and it's really interesting, and I probably just want to share a little bit more about it today. So I am known as the Hormone Healer on Instagram, and the reason I became so fascinated with the female body and all about hormones was because of my own pain, my own struggles. And I just didn't have any help or support. In fact, it was very, very scary for me, as I'm sure you'll be able to relate. Some of you will be able to relate. In fact, I was shit scared because I didn't recognize who I was, the body I was in, or the mind. You spend most of your life as a woman looking after everybody else. And then when this starts to go, who is there to look after you? Because we are that emotional support for our loved ones. So we don't really tend to get that emotional support back or that understanding. And it's very frightening because the only place that we've been told that we go for help is the doctors. And that doesn't always work out, does it, ladies? It hasn't worked out for me. I was actually really frustrated and disgusted in the service that I got. And it was scary to the point where I didn't want to be here anymore. I used to wake up and thought, I don't want to live another day in this pain, mentally and physically. I don't want to feel like this. Who's going to be there for me if I don't get through it? Who's going to bring me back down to a normal place, you know? Who's going to be that rock, that support? And then there was another big part of me that didn't want to be a burden on anybody, you know? I didn't want to come across as some mental person or needy person or, you know, take up people's time. So that was another big factor of it. And you know how people say, you know, you should always talk and you should always reach out. I just don't feel like it's truthful, if I'm honest. It's always when it's too late oh, you know, they should have spoke. But if I'm honest with you, yes, speaking can help, but it's support more than anything. It's having that support, but it's having that support because that somebody wants to give you that support. You know, I think that's really rare to find. And some people find it really helpful talking to a stranger or a therapist, you know, but some people don't find that support, that way that works for them, and they're completely alone. And I feel like there's a lot of things that can be done to help us heal, but we're not shown it and we're not taught it from a very young age. We've been programmed into thinking and feeling a certain type of way when that shouldn't have been the case at all. Like, you know, you grow up with the messages that you've learned over the years, like from, you know, from birth. So it's almost like we're all computers and we've all been wired a certain way, if that makes sense. Social conditioning and everything else. Yeah, the full shebang. So my platform's all about healing. It's all about you realizing that you have so much more control over yourself, and healing yourself without having to rely on the system. Like, but not just healing, but actually understanding how to heal. Like, understand your body, what goes on, how it all works, and how it's all connected. That's what I teach. But it's hard. I'm not gonna lie. I've been doing it for years and it's hard to get it out there. You're blocked. Or it's coming from a woman, so therefore it's not credible. Like, we're still facing times like that where it's hard to climb a ladder as a woman. Or you've not been on Love Island, or you're not a celebrity, so therefore, you know, you're not in the public eye, so you're a nobody, sort of thing. Oh, it's really frustrating, if I'm honest. That you push and push and push and push, and you try and get your work out there, and it's hard. Like, you honestly, guys, it's a constant battle of trying to grab people's attention. If I could physically put my hands through the phone and shake you, I would. Or say, you know, stop wasting your time with the brainwashing and brain damaging shit that they put on TVs and social media in front of you and around you and on adverts. It's everywhere, going in your ears, eyes, everything. Stop that. Focus on this. Focus on what I'm telling you. Yeah, if I could do that, that would be great. Like, your phone's always listening to you, remember? So yeah, I didn't know what my first episode was going to be. For those that work with me and those that have followed me for a long time, you know that I just speak from the heart. I've never really gone in with a plan. It's just not genuine to me. Rehearsed is not genuine to me. There's things that I'm passionate about and there's things that I want to talk about. So it's whatever flows at the time. So whatever I want to talk about at the time. And that's what it is. This platform is for me to talk about things that I either disagree with, agree with, or don't like, or whatever. And it's just to share my opinion and for you to share your opinion or give me another side of the coin for me to look at. Because I am open to that, because I'm not right. I don't know everything. I don't. It's only what I've experienced and seen with my own eyes. And when you take care of yourself, your brain works and you're awake. You're not as easily fooled or scared. That's powerful, but it can also be, sometimes it's easier to be ignorant, right? Or in denial, because we don't really want to face reality. Sometimes that's easier, right? I get it. But it's not when it concerns your health and your happiness. It's just not. It's not worth it. So, in this particular video, and I do apologise, I do go off on tangents sometimes, I want to talk about the fact that our nurses in the and doctors in the UK are not trained in nutrition. I do think this is globally. I can't comment on America because I'm not from America, but I can guarantee they're probably not. That's scary, isn't it? Our doctors and nurses are not trained in nutrition, because nutrition is one of the most important factors to your healing journey. Nutrition is everything. Like, what you feed yourself is everything. Food heals. It's powerful. And when you start to become aware and educated, you start to realize that, and you make better decisions for yourself. And it was shocking to, well, it wasn't shocking to me, but it might be shocking to some of you, that they're just not really trained in it. So, I mean, you've only got to go, and they don't look healthy themselves, do they? And they're giving you advice, and you just think, or if you do ask them questions about food, they just look at you with a very blank look on their face, don't they? They're like, I've got a clue what you're on about. I've only been trained in, you know, checking your blood pressure and giving you some pills when tap on the computer. Okay. You know what I mean. So that's the scary thing right there. So we're going to the doctors to get help and support on how to heal. They're not even trained in the very basics, like the starting point of any healing journey should be lifestyle, right? So 4.4 million people in the UK live with diabetes, and another 1.2 million could be living with type 2 diabetes, but they're not yet diagnosed. So just take that in, 4.4 million people have diabetes in the UK. That's just the UK. I can't imagine America and all the other places. But just sit with that, because that's all about blood sugar, balanced blood sugar. So that is to do with nutrition. What is the treatment for that? I know it's not diet. It's insulin injections or tablets. Last year and the year before, the cost of treating patients with diabetes in England was 1.53 billion of taxpayers' money. 1.53 billion. And in 2020, the global insulin market was valued around 26 billion, and it is still growing. That's not going to get smaller. That's just going to keep growing and growing. And the biggest manufacturers, companies involved for the pharmacists, for creating these medications, yeah, who owns them? Shareholders, private investors, and people with a shitload of money. All right? Yeah. It's all about profit. That's all it will ever be about. Follow the money. It's all about lifelong prescriptions, because if you are a constant repeat customer, they're in business. So we're not focusing on nutrition, which can cure diabetes. Don't need the medication. Well, let's be honest here. Let's get real. Let's throw a curveball in. Let's say they were taught about nutrition, real, I'm talking real food here, pro-metabolic food. And I'm talking a balanced meal of fats, carbs, and proteins that are going to keep your blood sugar balanced throughout the day. Little meals, little and often, right? Imagine if that was the treatment and you was given a program to follow, and you followed that and you lost weight, you healed. And I'm not just talking healing in terms of your diabetes, but healing in so many other ways, mentally and physically, inflammation, hormones, hair loss, skin, nails, muscle mass. Because that's how powerful nutrition is. But if that happens, right, then there would be no need for the medication. And therefore, the rich wouldn't continue to get richer. Because it's true what they say, rich get richer, poor get poorer, because it's us paying for it. Taxpayers are paying for it constantly. They make you sick and then we pay for it. So you're getting sick and you're paying for the medication to mask it. So they don't want you to ever be cured. All right? I mean, that's the way that I see it. When you look into who own the companies that are manufacturing the medications and the pharmacies and the food companies, you will see some top investors that repeat every single time. And they own private hospitals, NHS. They own parts of the NHS in certain areas. So the most important thing for them is to make money. That's it. This is why you need to wake up and start taking charge of your health. This is why I'm doing this YouTube channel. This is why I am really like putting myself out there and expressing my opinion. And what I've just read out to you there about 4.4 million people with diabetes, how much it costs, all that is true. And I'm sharing that with you. It's not something that you see in the papers really, or in the news. They share what they want to share at the end of the day, right? That's the truth. They'll only share what they want to share. You'll never ever get the full picture. So my message today in this first episode, and I've done this first episode based on what's in here in the heart and how I feel. And that's what it'll be. Every time I release an episode, it's because it's something that I'm passionate about. It's something that I want to talk about. It's something that I want to be open about. So it would be great to hear from you. Comment, ask me questions. I don't share your opinion, share your experience. Do you suffer with diabetes? What has your experience been like in terms of getting help? Have you healed yourself, or are you still relying on medication? Let me know in the comments. Make sure that you like and subscribe and share. You know, share the knowledge with your friends, because knowledge is power and we've never had it, especially as women. And remember, ladies, we are so much more sensitive to everything because of our hormones, because we're so much more complex. So a lot of these studies that have been done on men, because men don't have menstrual cycles. So the data is simple. So any kind of data and studies is come from either men or male rats, right? Just keep that in mind. So this is why it's important we start to wake up, we start to invest, we start to learn about how to take care of ourselves, because we're just getting sicker. And that's not a lie, because health is wealth and that is everything. If you want me to talk about anything in particular, I am open to more ideas, more content ideas. Throw them my way. Comment, let me know. And I would love to be able to talk about things that are, you know, bothering you, or maybe you want to know more about anything. This platform's pretty open. It's not just about hormones, but maybe you're interested in my opinion, maybe you're not. Maybe you've come across my YouTube and thought, oh, this scale's not for me, and that's totally fine. Because at the end of the day, not everyone's going to agree with what I say, and that's also totally fine. So I hope you enjoyed the first episode. Watch out for more to come. And yeah, I cannot wait to connect with you all.